In this video, I want to talk about a minimally invasive lumbar fusion. Just for starters, why in the world would we do a fusion on the spine? Because historically, nobody gets better, right? And I think we've all heard or have friends or have neighbors or have acquaintances that has had a back surgery and they did a fusion and they're no better. Well, there are patients that have had lumbar fusions in the past and have not gotten better. In some cases, they've gotten worse. We try to be selective with patients that we think a lumbar fusion would be beneficial for. I can tell you that the technology is better than it used to be. The minimally invasive approaches the patients recover more quickly. And if we are selective and you or the patient is prepared for surgery, the outcomes can actually be quite good. Typically with a minimally invasive fusion, we're looking at 1 or maybe 2 levels of pathology in the low back that we think need a fusion. Typically a slip disc or a spondylolisthesis with a pinched nerve is a reason to do a fusion. If a patient has really severe pinching of the nerves and we've got to go in and remove a lot of bone, and by doing that, we've rendered the spine to be unstable, we'll elect to do a fusion. That conversation is something that I think every patient should have with their provider. Why would you recommend a lumbar fusion? I want to talk a little bit about the procedure itself, the risks, and the recovery. So it's done under general anesthesia. We put a small pin in the hip for the navigation, and so the patients have a tiny little incision over the hip bone or the iliac crest. We do a CT scan, and then we use that CT scan to put in the screws. Fortunately, this technology has allowed us to put the screws in very accurately and precisely every time. And with rare exception, do we have a problem putting the screws in. The screws are placed through 1 incision on the left side and 1 incision on the right side. So the patients have 2 incisions where the screws have been placed. We then place our retractor through 1 of the 2 incisions and go under the microscope. Once we're under the microscope is when we do our decompression part. So when we do a fusion, we're almost always also doing what's called a laminectomy or a decompression, which means we're freeing up the nerves. We're removing any bone material, any ligament material, disc, etc., to make sure that the nerves are no longer pinched. Once that's done, we take the disc completely out and we take the bone graft that we've harvested from the decompression and we put it in the disc space. What I usually do is I file the bone down with a drill, kind of like a dentist does when they drill out a cavity. And the bone dust goes into a sucker and is collected in a canister. We take that bone graft, your own bone, and put it into the disc space. And that's what causes fusion from one bone to the other. We'll also put in a little spacer to help support the disc and maintain its height. Once all of that's done, where the bleeding's all stopped, if there is any, and the nerve and everything is freed up, we check another CT scan to make sure that all the hardware is in a good position and we're satisfied with everything before closing the wounds. As far as risks go, I think the main risk is that the fusion doesn't take. For some reason, the patient doesn't fuse and requires another surgery. Another risk is a spinal fluid leak, which fortunately is uncommon. There's a risk to injuring the nerve, and that's fortunately also quite uncommon. Generally speaking, and I'm not sure that you would call this a risk, but there's a chance that this surgery does not improve the symptoms significantly. And the most important thing there is to just select the right patient for the right surgery. The recovery is, in general, probably about 4 to 6 weeks. The patients can be up and walking right after surgery, and there's a fair amount of muscle spasm for a day or 2, but that subsides pretty quickly, and then they gradually increase their activity as tolerated, paying attention to how their body is feeling. I'm fairly comfortable anymore allowing the patients to return to almost all activities within 2 or 3 months. For some types of things, like if it was a contact sport or an extreme sport or really heavy lifting, we might make them or have them wait a little bit longer. Lumbar fusion surgery through a minimally invasive approach is an effective way to treat some spinal pathologies. The most important thing in my mind with a lumbar fusion is to find the right patient for the surgery and then to prepare them for surgery. The surgery itself has some risk, but fortunately is low, and the recovery is about 4 to 6 weeks, and after that continuing to progress as tolerated.